So today we're going to be going over how to do diaphragmatic breathing. And we have Barbara here, who has volunteered to be my victim for diaphragmatic breathing instruction today. So the very first thing is that you'll want to be in a relaxed and comfortable position. Are you in a relaxed and comfortable position? Perfect. All right, so we have that. We want now for you to have one hand on your belly, one hand up at your chest, and you're going to just take a deep breath for me. And then tell me where that you feel that breath. Is it underneath this hand that's at your belly, or is it more at the hand that's at your chest?
It's actually both.
Okay, so here's what I want you to try. I want you to try to minimize it up here and maximize it into the hand down below at your belly. That looked really good. It looked very silent up here. I didn't see any movement. Did you feel any movement there?
Just slightly.
Yeah, and that'll be, if it's just slight, that's fine. And that means that you're the majority engaging the diaphragm muscle. And then that is making it so that you are taking in breath with that muscle rather than using the muscles up around your neck and that attach onto your upper chest.
It's a little practice.
It does take practice, but practice makes perfect, and perfect practice will make it so that you get relaxation, you get calming of your vagus nerve. There's many other benefits. It's been shown to reduce blood pressure. So those are all very helpful things for you to heal. So you want to engage that as often as possible. And there's a little trick to the end of it that I want you to practice now. So I'm going to have you go ahead and take that nice deep belly breath in, and then you're going to allow it to come out. You can do that through your slips. You can do that as a, and then I want you to go that extra little bit and just try and get it out with a little tuck of the belly, and just try and bring your belly button towards your spine. There, that was it. And that gets that extra little bit out. Did you feel it?
No, I was trying to breathe.
Try taking another deep breath. And then on the exhale, after you've done a relaxation exhale, then I want you to give it that extra little bit where you just draw your belly button towards your spine and see if you can't get that extra little bit out. Did it work?
Yeah.
Excellent.
It did.
All right. You have correctly done a diaphragmatic breath.
Wow.
You didn't need much instruction.
Oh, good.
But if it doesn't go that way with y'all at home and you end up with some chest breathing, then it might be time for you to see a physical therapist so that you can work on muscle re-education and being able to engage that diaphragm. Thank you very much for watching.